Abroni! Abroni! Up here! Aquaba! Welcome to Africa! And the same. Mahoye? Good. Let the role of the nurse begin.
In Ghana, the role of the urban and rural nurses are very different. In the smallest clinics, in the smallest villages, clinics will be staffed by 1 or 2 nurses who provide all health care. They do assessment, diagnosis, prescription, treatment, along with more traditional community health roles such as home visits and school education. In the bigger villages and the bigger clinics, they might have a PA or a midwife as well, and so they have more expanded treatment capabilities. Nurses, on the other hand, that are working in hospitals have a less independent role. They work under the doctors and don't question at all what the doctors say. There is hardly any critical thinking involved, but they do play a key role in patient care. We noticed in the hospitals that there's generally 3 to 5 nurses per floor, and each floor can have anywhere from 20 to 40 patients.
Uniforms in Ghana are very important in general. They show that that you have a very important role in society. And so by the way the nurses take care of their nursing uniforms, you can tell that they really respect and honor their job. Nursing uniforms are all white, but the things that vary are the charge nurses have different colored belts to signify their rank. The nursing students have different stripes signifying which year they're in, so if they have 1 stripe, they're in their 1st year. In nursing school, the education that they receive can vary from getting a certificate, like an associate's degree, which is called a diploma. Then they have the bachelor's degree, master's degree, and PhD. So their bachelor's degree is 3 years. The nursing students have to do service, national service, every time after they graduate, and the number of years that they have to do it depends on how much they have to pay the government back, because the government will pay for their school if they cannot pay their full tuition, but then they have to do national service if the government pays. So remember that, because it will come up in your life again. And so they can vary from 1 year to 5 years in their national service that they have to give.
This is a CD. This is Ghanaian money. This is a 5 CD. So I am talking about the salary that nurses get here in Ghana. Depending on where you work, the salary is set by the government. So community nurses that work in the rural areas earn about 600 CDs per month, which equates to $353 US. Their housing is included, however. They get like a 1-room kind of bedroom included, and so they don't have to pay for housing. If you work in a hospital, you earn 800 CDs a month, which equates to $470 US. Midwives earn the most. They earn $1,200 a month, which is $706 US.
One way that the role of the nurse is impacted by cultural beliefs in Ghana is that Ghanaians do not show pain, especially in childbirth. This also impacts when patients come to the hospitals and see nurses, and the nurses end up seeing a lot of very acute patients because of this.
Another belief is that people in authority are respected, and so people below them don't ask questions. That applies to the nurse and also to the patients. So nurses don't ask questions about diagnoses, they just do exactly as they're told. And patients don't ask questions to nurses because 1, the nurses don't have time for them, and 2, they don't know what to ask a question about. And so patient teaching just doesn't happen at all.
A third cultural belief is that Ghanaians are very focused on the present time. They don't think about the future. So
preventative medicine doesn't really happen in Ghana. They have a long ways to go still here. For example, instead of changing a wound dressing that we saw, they just gave antibiotics to the wound that was infected.
Ghana has national health insurance and is relatively affordable for most Ghanaians. It is about $7.65 for one adult per year and is $2.22 for one child per year in the rural areas. The price increases a little bit in the city since there are bigger facilities to finance.
The healthcare systems are a little different between the rural and urban areas. In the rural areas, there are very few or no doctors. Because of this, the nurses are the ones to see the patients, diagnose them, and prescribe their medications. Since nurses have less education than doctors, we've seen that nurses participate in cookbook medicine. They listen to the patient's symptoms and quickly diagnose based on what their books say. There isn't much critical thinking involved.
In these rural areas, they also have extremely limited resources. They basically have no technology. They have no gloves, alcohol swabs, or hand sanitizer. They only have about 15 to 20 medications to prescribe to people. Most of them are for malaria, pain, parasites, or are antibiotics. All of these limited resources make it difficult for the nurse to give optimal care.
The transportation in these areas is mainly walking. This limited transportation makes it especially hard for patients to get to the clinic or get any kind of treatment. We also saw how healthcare systems work in urban areas. We saw a lot of the same limited resources in urban areas, but overall the healthcare is a lot better in the cities. There is a lower nurse-to-patient ratio, and there are doctors in healthcare facilities. This allows for nurses to focus more on their own role.
The supplies and technology are much more advanced than in the rural areas. The availability of taxis and public transportation make it much easier for people to get access to healthcare in the cities. Overall, nurses in the urban population can better fulfill their role as a nurse.
There are many different social determinants that influence the role of the nurse here in Ghana. The most common social determinant is poverty. Since many families only make about $1 a day here, they are not able to pay for adequate health care unless they have national health insurance.
Poverty also affects hospitals as a whole. The hospitals here have only funds to provide basic resources. Even some important resources are scarce because funds are non-existent. While I was in labor and delivery, one of the babies was becoming very cyanotic. It was obvious that she needed some extra oxygen. When I left my shift, the baby still had not gotten any oxygen because the hospital had a low supply. Since there are limited resources and supplies, many nurses make do with the things that they have. We noticed that in many of the hospitals that the patients are in charge of bringing their own supplies, but the nurse just performs the act. Without the supplies, the nurse cannot perform her caretaking role.
Education is another social determinant that affects the role of the nurse. Many of the health promotion posters here and medication instructions are written in English, so those that don't speak English are not able to fully understand how to take care of their health.
The last social determinant that affects the role of the nurse is the lack of transportation. Many people must either pay or get a ride to a hospital or a clinic in order to see a midwife. Some also walk miles in order to do this. Although transportation seems more like an individual problem, it can affect the role of the nurse as well. For example, if a woman can't get transportation to their prenatal checks, they have an increased chance of having problems at birth.
One of the first groups that we're going to talk about are women and children. They are a focus group of the national healthcare system. And there's two parts. There's the urban and the rural areas. In the urban, prenatal visits and preventable care is free if they have insurance. In rural areas, they can have free prenatal visits and preventative care even without insurance. In fact, in one of the areas, nurses went door to door giving all the children shots as a preventative measure for free. Preventative care in Ghana is often aimed at women and children, not much for the males. Next, we're going to talk about rich versus poor. The rich get their own private insurance. It's kind of like VIP insurance, so they get to go to private hospitals.
Despite the similar ratios at private hospitals and public hospitals, there are many differences between these two.
For private, each of the patient has their own room. It's much cleaner, and they have better supplies.
In public hospitals, the patients are crammed multiple people into the same room, and they have an extreme lack of supplies.
Although anyone can receive a referral to a private hospital, they have to pay the difference, so often the family will help with this.
Here in Ghana, we've come to realize how much culture impacts our role as the nurse. One of the primary roles of the nurse is patient education. It is important to understand each patient's culture in providing culturally appropriate education and nursing interventions.
We've also realized how important it is for us as nurses to be actively involved in healthcare policymaking. The national health insurance here in Ghana can often limit the amount of patient care a nurse can provide. So we must be proactive in understanding and getting involved with healthcare reform in the U.S.
Another thing we have learned from our experiences is to not underestimate the intelligence of people who have a lack of resources.
Finally, we feel it is very important to not make assumptions and to always remain culturally sensitive in providing patient care.
If you come to God.